Hi guys, my name is Brianna and I did my research paper on nutrition and wound care. As community nurses, the most common wound that we are going to see are going to be from pressure ulcers, and it is our job to prevent them and also promote the wound healing process, but mainly prevent because it's a lot easier to prevent them versus treating them. So throughout my article, the author talks about 3 patients who are at high risk for developing pressure ulcers which result into wounds. And those 3 types of patients are patients who have type 1 or type 2 diabetes, obese patients, and malnourished patients. And they also talk about how nutrition plays a key role in the wound healing process. Type 1 and type 2 diabetes are the most common cause of peripheral neuropathy. And if a patient has high blood glucose levels, this can lead to tissue viability and particularly cause foot ulcers. As a community nurse, we play an essential role in managing and monitoring patients' blood glucose levels while they are under our care, as well as reducing the patient to develop a foot ulcer. For patients who have type 1 and type 2 diabetes, it is important that the blood glucose levels are well controlled. And that is why nutrition is particularly important, because diabetes influences the use of carbohydrates for energy requirements. And when a cell responds poorly to insulin, this can lead to a result of inadequate energy being provided for the cell, which can inhibit the healing process. For patients who are obese, they have a limited circulation due to the higher rate of fat tissue, mainly adipose tissue. And this can complicate the healing process and increase the risk for BVD, DVT, and wound infections. Patients who also fall under this category are patients who have limited mobility. They also have a high risk for developing pressure ulcers, which lead into wounds. And this is extremely important why healthcare professionals collaborate and work together. And in this case, registered dietitians are able to support community nurses in this aspect because they are able to provide endless amounts of support and education for these patients who are wanting to make a healthy lifestyle change. And then we have the malnourished patients who they are also at a high risk for developing pressure ulcers that lead into wounds. And Quinn has stated in this that patients who have 30 to 20 to even 10% loss of lean body mass have impaired immunity. They also develop an increased risk for infection and a decreased wound healing time due to thinning of the skin. And because of this, they have a delayed healing process. Okay, so now on to nutrition. Protein mainly, the macronutrient, plays a vital role in this because of tissue repair as well as collagen production. And there are some amino acids and we all know protein, it is a chain of amino acids, and there's one, glutamine, which is responsible for the energy source for neutrophils, macrophages, and lymphocytes. And vitamins and minerals also play a specific role in the wound healing process, and they can be found through various dietary sources. So, all in all, wound healing is a complex process, and it is a challenge for us community nurses, but we do play a huge role in preventing and promoting and treating the wound healing process.